And get started. Hello, and welcome to the Department of Public Health Sciences seminar series. My name is Lisa Brancaccio, and I am the Professional Development Officer here in the Department of Public Health Sciences. And it's my pleasure to lead our seminar today. So we like to begin these seminars with an acknowledgement of the significance of the land we are on and recognition of its original inhabitants. I'm joining from a very rainy and icy day here on Queen's campus, which is the traditional territory of the Anishinaabe and Haudenosaunee people. I'm thankful to be able to learn and come together with you today on these lands. So today's seminar is on Preceptor Perspectives, Components of a Successful Practicum. The practicum component of the MPH is a central piece of our students' learning process. It provides an opportunity for students to get out of the classroom and apply the theories, methods, knowledge, and skills learned in their courses to current public health issues and innovations at a host organization. And so at the host organization, students are guided by their practicum preceptor. For today's seminar, we have a wonderful panel of 5 preceptors who have guided many of our students through this vital part of their learning. And so with this panel today, we'll discuss examples of projects and activities MPH students have completed during their practicum and where they did those. We'll talk about the benefits and outcomes of practicums for students, preceptors, and organizations. And we'll discuss a little bit about some student skill sets and competencies that can help enable a successful practicum. And then we've saved time for some audience questions at the end. If something pops into your head during the seminar, if you have a question, feel free to put those in the chat box. And so we'll get to those during the Q&A period at the end. So thank you all for being here today. And let's jump into introductions of our panelists. We'll begin with Megan Carter. Megan, if you could provide an introduction of your role and organization and share some examples of past placements. Over to you. I'll put 5 minutes on the clock now.
Okay. So I am a research associate at KFLNA Public Health, and I'm an adjunct assistant professor in Public Health Sciences Department. As you are probably well aware, in Ontario, local public health units, the one that I work for, are responsible for health promotion, prevention, and control of disease in collaboration with local, provincial, and federal partners. So this is really key. We don't do things solely on our own, and we're not funded to do that. And you've probably recently seen well, obviously, we all know the COVID-19 case and contact management and mass vaccination. I think everyone's familiar with public health in that role, but we do a lot of other things that I really don't have time to get into here. There are 34 of us in the province, but this will be changing over time as we have been asked by the province to consider mergers. So we're considering merging with our sister health units. KFLNA covers the city of Kingston, the county of Frontenac, the county of Lennox and Addington. So we service about 214,000 people. Our catchment area it's vast, but it's not as vast as some other areas across the province. It's still quite large though. We have almost over 200 staff and 150 volunteers. And at one time, a resident turkey family. I love this photo. If you're wondering why it's up there, I don't know why, but and I'd also just like to recognize that KFLA comprises the traditional lands of the Haudenosaunee, the Huron-Wendat, Mississauga, and Anishinaabe nations. I'm grateful for the care and the attention that they brought to these lands and all Indigenous communities that currently live and call KFLA home. Now, in terms of what I do at KFLNA Public Health, sometimes I feel like I'm a jack of all trades, master of none. I help support population health assessment and surveillance in knowledge management. I am involved in lots of different evaluations with teams who are either trying to build the evidence going forward in planning, or they actually want to make a judgment call on one of their programs. I work a lot with the MPH program and Public Health Sciences Department in developing roles for you MPH students here at KFLA Public Health, but also in actual conducting research projects and supervising PhDs and MSCs. So in terms of placements, we have had a student here. So in my role, I do preceptor, but anyone really across the agency can preceptor a student if they want to. So it's not just in my domain here. And I'm going to speak really to the projects that I've preceptored, but there have been examples of others that I'll touch on at the end. So I've precepted a project that was an epidemiological analysis of the association between social capital, measures of social capital, and self-reported physical health and self-reported mental health. And the student explored this association using multiple variable logistic regression, accounting for confounding and exploring effect modification. She did this with the Canadian Index of Wellbeing survey that was conducted in KFNA. So it really helped to add to our local knowledge of social capital and health outcomes. And she developed a report, a scientific report that could be used to write a scientific article. And our MOH at the time was actually really interested, and I think still interested, Dr. Kieran Moore, interested in how social capital factors relate to health outcomes, specifically in older adults. In 2022, we were looking at helping COVID-19 recovery and getting back to normal business. One of our students worked with me and the librarian to do a rapid mapping review of the indirect health outcomes of COVID-19. So like the shutdowns and things like that, not mass vaccination. And so she mapped at a high level, mostly, well, concentrating on synthesized research, because as we got into it, we found out that there was a lot of studies being done, and it was quite overwhelming. So she's focused on synthesized research and mapping that in a tabular characteristics of the studies in the tabular format. And then she did it with primary studies at an even higher level. But the results of this review were sent to all staff actually, and helped with their planning of potential priority areas to target going forward. And another student ended up doing a review of priority setting frameworks there was some synthesis in that, but it ended up being an annotated bibliography with some pointers in terms of pros and cons of different tools and how they can be used in a local public health agency. And she also worked with our librarian, and that was shared with senior leaders to help them in priority setting, strategic priority setting going forward. We've also had a student last year evaluate our routine immunization and our COVID-19 vaccination dashboards. This was more of a qualitative evaluation on user acceptability and usefulness. She ended up doing a structured interviews with 9 public health staff, transcribing those in teams, actually encoding and coming up with recommendations to improve the usability of the dashboards to make decisions around vaccine implementation and how the dashboard could become more useful. And then another student helped develop the rationale for a research project that we are embarking on here, point of care testing for syphilis. So this person had to explore our EMR, had to explore the provincial database for reportable diseases to see if they could develop or determine time to treatment. So how long it took historically for our cases to be treated for syphilis. So he developed the data set, cleaned it, ran the analysis and the reporting. So that was for our sexual health team. And like I said, I can't really talk much about the other placements, but I do know that we've had an IPAC placement here with our IPAC team. We've had students working with environmental health to analyze dog bite data, to also analyze wastewater data. And then often teams just need help shoring up the evidence on a certain topic to be able to actually to do anything in the public health planning process. So it could help in assessment, planning, implementation, and evaluation. So there's plenty of need here.
Thanks, Megan. Next, I'd like to welcome Mahario Sukai.
Good afternoon, everybody, and thanks for having me here today with you. I'm going to introduce myself first. My name is Dr. Mahario Sukai. I am the Vice President of Research and International Affairs and the Chief Accessibility Officer for the Canadian National Institute for the Blind at CNIB. I'm going to first start by apologizing on two fronts. One, I have what I think is a cold, hopefully is only a cold. And so I'm a bit stuffy and coffee. And two, I actually have a competing conflict at 1 o'clock, so I will step away early and hopefully we'll get everything in before I have to go. But anyone who wants to reach out to me to ask any follow-up questions, my email address at research@cnib.ca is on the slide. So I run CNIB's nationwide research program as its vice president research. That research program is a knowledge generation program. It is an active knowledge generation program. We do public health and social determinants of health research that is focused on Canada's blind, deafblind, and low vision community. That's a population of about 2.2 million people in the country. CNIB was established in 1918 and is Canada's largest service provider for persons with vision loss. Our client base is around 100,000 of that's 2.2 million. And so the research team's mandate as envisioned and structured as of 2017 is to really understand quality of life and lived experience of this community and to use that knowledge or to translate that knowledge so that service practitioners can develop programs and services that will help improve quality of life and lived experience. The mandate has been re-envisioned very recently as we've expanded our core operations to carry much the same focus, but we have a bipartite emphasis. We have an emphasis on person-centered data collection, so understanding quality of life, lived experience, social determinants of health of people who are blind, partially sighted, deafblind in Canada. But then also understanding at a systemic level the barriers and enablers that exist or don't exist in society that ultimately mean that a person, when they interact with those barriers and enablers, may or may not be included or may not be able to participate to the fullest extent in the world around them. We have, since 2019, taken 22 Queen's MPH students, all of whom have done really amazing things with us. Currently, 4 of those MPH students are either on staff or on contract with my department. So we do have a pretty good rate of going from, hey, actually we have 6, not 4. I'm lying. So we have a pretty good rate of going from being a practicum student with us to finding opportunities to keep you engaged if you want to be kept engaged. The kinds of research projects that people have been engaged in really range from program evaluation opportunities, particularly focused on some of our children and youth summer camp programs, out to understanding impact of COVID-19. One of the students in 2020 really kind of jumped straight into the immediate understanding of impact of COVID-19 during the first lockdown, and that was her practicum project for 400 hours, and she did an amazing job with it. And it ultimately got published in the Canadian Journal of Ophthalmology not too long ago. And so we have projects like that. We have projects where students are working on discrete pieces of work related to some of our flagship programs, flagship research programs. And so we're grant funded to do work that is public health related around employment, that is public health related around access to healthcare, artificial intelligence, access to social services. And so there's projects within there that we will assign to students when they come in, and students will be able to work on a number of things and a number of different skill sets, qualitative research, quantitative research, lit review, environmental scan, policy scan, and students really get to stretch a lot of the competencies that you learn in the program with us. One thing that I would also say is that as we move forward, our soon to be launched flagship research endeavor is going to be a 40-year, you heard me right, 40-year longitudinal study on the quality of life and lived experience of persons who are blind, deafblind, and live with low vision. That study has actually been developed and overall masterminded by a team that is consisting of 2 graduates of this program, and has been worked on by 2 students from this program in the last practicum period in 2023 summer. That project, when it begins to go live this summer, is going to be one of those where we'll constantly take students in to work on that longitudinal study and to be part of the data collection and data analysis. As part of the experience that students have when they come to CNIB research, what we do is we emphasize how to do accessible, inclusive, and respectful research. When you're working with a research team that is comprised predominantly of persons with lived experience with disabilities, that is led by myself as a person with lived experience with disabilities, and that works on and with and for issues of persons with lived experience with disabilities. And so when students come to be interviewed to join the team, I focus very much on your character during the interview. I focus very much on your willingness to put assumptions about disability to one side and to really come to the work with us with a bit of a fresh perspective, a bit of a blank slate. I've actually I've actually said to at least one interviewee, you're welcome to come and join the team, but in order for you to have success here, you have to really question the assumptions that you've demonstrated in this interview. So here's the invite to come and join, but if you're not willing to question those assumptions, say no. And that student rather respectfully a week later said, you know what, I'm not ready for this. And so when we do interviews, that's how I'm screening, because you know what, you have a great program. You're going to learn the things I need you to learn from a technical perspective. The things that you don't know from a technical perspective, I'm pretty comfortable we can teach you. It's the mindset of working with persons with disabilities, working on a team comprised of persons with disabilities, driven by persons with disabilities on questions that are disability related, that really get at the underlying ableism in society and how that impacts public health. Those are the questions where if I know that you're not comfortable in that space, then I could teach you, but you wouldn't really want to learn. So I just say that up front because a lot of students have provided feedback that says CNIB's interviews are really strange, and they are, because they're not typical interviews. Because the things that a typical interview asks, I'm pretty sure you'll all be able to answer those questions. I want answers to different questions. The students who come and work for us have collectively all had a great time. No one has really said to me they've had negative experiences. As I said, they've all stayed in touch. Some of them still work for us. They do amazing work. There's a range of projects and activities Across the breadth of my portfolio, as I said, I'm VP Research, International Affairs, and Chief Accessibility Officer. So there's work that goes on that's related to organizational culture around accessibility and inclusion. There's work that goes on around disability inclusive research and disability inclusive development on the international side. And there's lots of research questions that we have, almost to the point where like I'll submit more research questions than I have students for, because I know that there's a lot, and we've got something that will pique interest for just about anybody. So I think I'm gonna stop there and hopefully have time to answer a second prompt before I have to go.
That sounds great. Thanks, Mahadio. Hope to catch you for the second prompt there. Next, I'd like to welcome panelist Melanie Walker.
Hi, everyone. Good afternoon. Pleasure to be here. Thanks for the invitation. So I work in the Department of Emergency Medicine. I'm the research scientist as well as our resident research director. And I also teach in the School of Medicine. So I'm an alumnus from the program, did both my master's and PhD in epidemiology there, and then went on to do a postdoctoral fellowship soon thereafter in the Cancer Research Institute. So my colleague, Dr. Susan Bartels and I, so Dr. Bartels is an emergency physician and public health researcher. We've had the great pleasure of hosting 9 MPH practicum students over the past 4 summers, and every summer has looked a little different. And those students have worked actually as part of a larger team of students, ranging from undergraduate students through to medical students and other graduate trainees as well. And we've been working on what started as a singular health equity project has now turned into a bit of a program of research for us at the department. And this program of research is called the Reconnect Project. And so we've been very interested in the last several years to look very carefully using mixed methodology at the emergency department care experiences among a variety of different equity-seeking groups in the Greater Kingston community. So this has been a community-engaged participatory project that has involved well over 30 community organizations with this study. And we've had just tremendous success with the team members that have helped supported this work in the last 4 years. I can tell you briefly a little bit about what some of those placements have looked like, and we also have opportunities for this coming summer. In essence, as with research, every summer it seems has emphasized work related to a different part of the research process. So back in 2020, when we first hosted MPH students, we were really at sort of the study conceptualization and development phase. So our group of trainees, including our MPH practicum students, helped us with some literature reviews around looking at healthcare experiences among some of our more vulnerable populations, including those who have disabilities. Dr. Shikai might well remember being engaged in this project early on, those who identify as Indigenous, those who are facing mental health concerns, persons who use substances, persons experiencing homelessness, those who identify as visible minority, and or those who identify as 2S LGBTQ+. We did a lot of work looking at the literature early on and helping us to develop an evidence-based survey and develop those community partners in that early phase of the project. Those students were really tremendously helpful to us, some of which have gone on to actually publish systematic reviews based on that really good work, looking at the preliminary literature in the summer of 2021. It was actually our study recruitment phase. So with the help of a team of 8 students, including 3 MPH students, we actually recruited over 2,100 participants, both in Kingston's emergency department, the urgent care center, and at a variety of community partner organizations. The summer of 2022, the next group of trainees that we had working with us got to experience a different element of the research process, which was largely helping us to do the analysis and interpretation of the results. So a lot of some quantitative analysis, but largely a lot of qualitative analysis review, thematic analysis, use of in vivo, so developing some different research muscles there, if you will. And then this past summer, again, we were still doing some data analysis, looking at different elements of the project, particularly because we have many different equity deserving groups that we've been looking at. They also spent some time helping us to develop some ideas around quality improvement interventions, which is a subsequent arm stemming from this first project, where we want to take the results from this study and look for improvement opportunities in the emergency department to improve the care experiences by our most vulnerable populations in the community. In addition to doing that, we also had our MPH students in particular look at the quality improvement intervention literature. They also looked at some training opportunities for us that we'd like to implement in the department. And they helped us to start development of a new survey for our extension project that's going to be going on this coming summer, where we hope to start recruitment in the emergency department come spring. And this study is a little bit different in that we are not only including patients and individuals who have had previous emergency department experiences, but at the point of care in the emergency department and at our urgent care center, we are actually going to solicit input from both patients and their healthcare providers all along the pathway of care. Based on early results, we saw many different elements of the care experiences that need some more attention to detail and further analysis to look at patient interactions themselves, patient-provider interactions, and also systemic issues, because we know from knowledge translation slides that different interventions need to be addressed at different levels of care in order to demonstrate some effectiveness, which will form a subsequent aspect of this study in future years. I think I'll stop there, Lisa, and happy to answer questions as we go forward.
Perfect. Yeah, you're right on time. And next we'll go to Heather Candon and Paige Reason.
Hi, everyone. Pleasure to be here. Thanks for the invite today. So my name is Heather Candon. I'm the Director of Infection Prevention and Control in the nurse-led outreach team at Sunnybrook Health Sciences Center in Toronto. I'm joined today with Paige Reason, who's the Infection Control Quality Improvement Lead on our team. So as I said, we work at Sunnybrook Health Sciences Center, and I will just mention that I'm actually adjunct professor with the Public Health Sciences Department at Queen's and teach EPIT 852 as part of the IPAC specialization. So at Sunnybrook, we do take students each year since the beginning of this program, which we're going into our 4th year, I believe. So Sunnybrook is one of the largest healthcare facilities in the country. It consists of approximately 1,000 beds. We have a variety of services that we offer, one of the largest trauma centers. We have acute care beds, we have rehab. We have a very large long-term care facility that's specific to the veterans population within Canada. Our mission, vision, and values really are focused obviously around, providing the best possible patient care, but also, driving discovery, innovation. And we are a large teaching and learning facility. So I'll turn it over to Paige actually to talk about some of the examples of what we've had for past placements. But first, maybe I'll just mention sort of what an infection control professional is and does and what the role is. So essentially an infection control professional, it's really a critical role within the context of healthcare and public health in general. And the primary goal of an infection control professional or practitioner, as some call it, is to ensure that we reduce the risk of healthcare associated infections within the healthcare sector. So we look at trying to stop the transmission of infectious disease, whether it in a hospital, it could be a long-term care setting or another type of congregate care setting. And we work really closely with public health agencies and units as well that deal more with the community aspect of infectious disease. So the role of an infection control practitioner covers things like doing surveillance and monitoring within the hospital and actually monitoring what we're seeing as far as infectious diseases within patients, as well as staff. We do education and training. We implement very sort of guided standard practices for healthcare workers. We implement policy. We really deal with controlling the environment and making sure the environment is safe for patient care and for delivery of care. We do a lot of outbreak management. However, it's not the biggest part of the job. When you hear infection control, a lot of people think it's all outbreak management. It's actually a small slice of what it is we do day to day. We do a lot of clinical assessments where we look at how to safely manage patients and isolate them and or apply additional precautions as necessary. Believe it or not, infection control practitioners actually have a lot to do with construction, maintenance, renovation, and design of healthcare facilities as well. It's a very large component of our job. We are often involved in crisis management and communication We do research and innovation, and we work closely with risk and patient safety departments within healthcare sectors to make sure that we're safely caring for patients. So with that, I'll turn it over to Paige to talk a little bit about past placements.
Yeah, sure. Thanks, Heather. Hopefully everybody can hear me. So hi, everybody. My name is Paige, as Heather mentioned. Over the past 2 summers, I've been involved as a preceptor with the program for 3 different MPH students. And in general, when we've had these students, we've really tried to make it a very fulsome experience for them. So we want to try to expose them to as many elements of the job as possible in the short time frame of the placement. As Heather mentioned, there's so many different aspects in infection control in terms of the work that we do. So one of our main goals is really trying to expose the students to every single element. So we have them going into the lab, working with partners in reprocessing, and just really getting their hands dirty on the ground and seeing what all elements of the job are. From a project perspective, again, it's really varied. It depends in part on what's going on in the program at the time, what our priorities are, but also very much on what the students are interested in. We're really open and flexible to trying to accommodate particular areas of interest within infection control as much as possible. And just as some examples, in the past few summers, our students have done things like working on hand hygiene opportunities in our neonatal intensive care unit, so in the NICU, so a very kind of unique population within the hospital. Another student has been working on and designing videos that staff can use kind of just-in-time training if we have a patient with something like a viral hemorrhagic fever, so something like Ebola, teaching staff, how to don and doff the PPE, the personal protective equipment, because it's very specific for these types of organisms, as well as things like designing and creating through feedback from staff and working with other areas across the hospital, additional precaution signage. So those are some of the key projects that students were working on, but they were also involved in a number of other initiatives and endeavors that we were doing at the time.
We'll mention as well,
yeah.
just to add to that page, that we actually did some of the viral hemorrhagic fever videos that were created by the students. We did get to put some of this to the test when we actually had a patient arrive who had travel history and symptoms consistent with possible Ebola-like symptoms. So, I mean, these are real tangible tools that the students have actively developed and we're testing in the front line and doing little PDSAs. So it's quite exciting work. One of the things we really emphasize at Sunnybrook as well is that we integrate the students onto the team. So we're a large team. We consist of approximately, I think there's 26 of us now, between all team members. We do have Paige, obviously, as our quality improvement lead. We have a hospital epidemiologist, a medical director, myself as a director, and a professional practice lead and manager, along with our entire infection control practitioner team. So we really do try to encourage a student to be part of the team, come to team meetings, come to rounds, come to our research meetings, and really integrate and see what the day-to-day operations are of our team within the department and how and Paige rightly defined, working with the other departments. And really, we are a consult to all the other services within the hospital. So that's how we really try to integrate the students onto our team. And I will mention the 3 students that have had placements so far are either working as permanent or have gone on to receive contracts.
Perfect. That's so great to hear. So thank you all for those introductions. For the next part of the seminar, I would like to pose a few questions to our panel. So the first thing I would like to ask about is what types of growth or benefits to students during the practicum have you observed over the years? So when they come in fresh at the beginning of the summer to the end, what type of development have you observed? And please just feel free to jump in.
Well,
Maybe go ahead,
I can
Megan.
start. Sorry, Heather, if you want to go. I'm just becoming comfortable as a KFLNA employee, so gaining that institutional knowledge, knowing where to go, who to ask, understanding the machine that's KFLNA public health, that is local public health, that how the public health system works. I think that's really important. Again, like becoming more resourceful, knowing how to figure stuff out on your own with your colleagues, and then with your preceptor. It's also, I think, an opportunity for students to see how other public health professionals work and how they approach their work, because it's a bit different than what goes on in academia, right? Like out in the real world. They get the exposure to working in a professional environment, so they have a set schedule. a dress code. They need to understand, or they do get to understand that there's a lot of checks and balances that have to go in place when they develop a knowledge product. It can't just be one draft. It has to be many sets of eyes on it, so they get exposed to that. I think they develop project management skills, which is key in the real world. Understanding for us anyways, they develop that understanding of the scope of work that's required. That's different in academia versus what the different teams require. They understand that they need to target their knowledge products to certain audiences. Gaining confidence with the new skills that they've got. And then we also try, as others have said, to expose them to different types of activities in public health that are not necessarily related to their position. So for instance, here we conducted last year a strategic planning, and we held a World Cafe where all staff were invited. It was a day-long event that they could provide feedback in going to different rooms around the organization. So the students got exposed to that. And lastly, I'd like to say that they get concrete experiences and deliverables, and of course, a reference when applying to jobs.
Heather, did you want to add to that?
Sure. Yeah, I can say from the infection prevention and control side, one of the things we have really emphasized as we're going into this upcoming year of accepting additional students is ensuring that we have an intensive focus on sort of the clinical assessment skills that are required by an infection control practitioner, because this really is a profession in itself, and there's a set of core competencies and practice standards that infection control practitioners need to have and understand so that they can work in different sectors. So ultimately, there's the theoretical training that you receive, the foundational training through the specialization with the courses, but actually learning the clinical aspects of the job, how to assess a patient's chart, how to go through and make decisions about their care, how to write notes in a electronic health record. So really focusing in on those clinical aspects and going to rounds and working with our medical director and our associate medical director to understand the day-to-day operations and what it looks like to be an infection control practitioner. Paige, I don't know if you have anything to add to that.
Yeah, I was just going to add, I mean, I agree with everything you said there, Heather, and I think it's just been really wonderful to see the growth over the practicum. Students come in, they're very energetic, they're very keen, and we often start them off with, there's a lot to absorb and learn kind of before they dive in. So there's a lot of reading, orienting kind of in the first couple of weeks. But then by the end of the summer, they're running education sessions for staff. They're leading projects within our team. They're out there on the unit shadowing and starting those clinical assessments. So it's really been amazing to see that growth. And that's really going to be the focus, as Heather mentioned, going forward, is to promote that amongst our students and to help them, reach those goals.
Dr. Walker, any additional developments or things that you've witnessed?
Sure, I'm happy to add a few. Those were all really incredible suggestions. I think ours has been a little bit more academic. I think the trainees that have come and worked with us have really had the opportunity to take that sort of textbook learning, if you will, and apply it to a research study, which, comes with all of its perils and pitfalls, because research is, as we know, it's a marathon, not a sprint for those of us who are involved in that. I think this project in particular has allowed for our trainees to come in and meet a multitude of stakeholders and develop some expertise with those who deliver mental health care services, those who work with people with substances. And in many, many cases, I'm really proud to say that our practicum students have actually gone on to obtain jobs in those areas they developed expertise on, stemming from the practicum. I also think, so in our case, we tried to give everyone sort of some sole responsibility and take leadership in an area that they can feel autonomy in. But in our environment, a team, sort of working with a multidisciplinary team has been really key. And so I think that's been, a real advantage in terms of some of the skill sets that they've had as well. And we've also just provided some hands-on application, right? Many of our trainees have done the wonderful qualitative analysis course, and then they come and they're actually doing qualitative analysis of the shared experiences of people in our community. So I think it brings all of that theoretical knowledge to life, and allows it to be applied in a really useful way that they can see us making tangible changes to the care of our patients in our community based on the study and the foundations that they've learned in the program.
Absolutely. Thank you. So we talked a little bit about those type of benefits that doing a practicum could bring to students. Next, I want to ask about some of the benefits as preceptors that you get, or, you know, for your host organization that hosting a student can bring. Heather, do you want to start us off with this one?
Sure. I mean, there's major benefits. I mean, each one of the students that has come has worked on a project that's actually put into, you know, real life application. There is major benefit in sort of shadowing with the team. They really do help in and sort of jump in and really sort of work actively first, you know, shadowing side by side with practitioners, and then ultimately moving on, as Paige said, to, you know, doing those huddles, doing education, answering those calls, going to the unit, talking to staff. So there's benefit in all respects. It's nice to see our team you know, continue educating the next round of infection control professionals as well. Paige, I don't know if you have anything to add to that.
I would just say, and maybe this is more individually in terms of people on our team, it's also just really wonderful having new, students come in, and they've all so far, brought their own skills to the team, which we have benefited from, whether it's, being tech savvy or, communication skills, or and those are always great to kind of, bring new people in that bring all of those things to the team, and we've benefited hugely from that. So it's been great.
So it sounds like the students really become a member of the team and contribute. That's great. Megan, over to you.
I think they help us to revisit some of our policies and procedures to better meet their needs and the needs of other student placements. So we definitely take into feedback, or take into consideration their feedback in their positions. And this has been mentioned that it helps us with work that needs to be done. So it really, they help to create deliverables and knowledge products that can be used and I said this before, anywhere in the public health planning process, from assessment to planning to implementation to evaluation. So the teams really appreciate that. It's stuff that's, needs to get done. But staff don't always have the time to do it. It also gives us an opportunity to think about doing extra things that we wouldn't have had the opportunity to do. So these are the nice to haves, and this expands our capacity. I think it also is a good for our organization. It's a good leadership competency development. Different staff can be preceptors, so this can be added to their IPP, as we say. They can develop their own competencies in leadership. So I think it's a good incentive in our organization to have MPH students.
And Dr. Walker, anything to add to that? Megan, I think that was perfectly said.
Yeah, it's fantastic. Too many benefits. In fact, I'm almost embarrassed to say, I don't know if we benefit more, or if our MPH students have benefited more, to be honest. We have just been so fortunate to have such a great group of engaged, enthusiastic, and energetic folks join us. They've advanced the research, right? Dr. Bartels and I wouldn't be as far ahead and developing a more systematic program of research if it wasn't for the fantastic trainees we've had who have contributed to survey development, community engagement, recruitment of participants, or, data analysis, et cetera. And we're really fortunate because, for whatever reason, our MPH trainees, stemming back to 2020, in many capacities have still stayed on working with us beyond their practicums, because they've been very interested in the project itself. So we've been really fortunate to help many of them move forward to publication, and they have just been overly generous with their time and dedication. So lots of benefits.
So wonderful to hear. I completely agree. And Dr. Walker, I'm going to start with you for this, our last question here. What would you say are some of the key traits or a specific mindset that a successful practicum student, exhibits throughout the practicum? Or even you can speak to what you would look for when selecting a candidate.
Yeah, great question. And I think this might be a little bit different depending on what you're looking for and what the organizational needs are. And I thought Dr. Shikai's comment was quite interesting about his interview questions. I'm going to have to ask him about what those were. I think for us, because we have been very much working in a team environment for the last several years and will continue to do so, we really look for team fit in some ways, which might sound a little strange. But things like strong communication, ability to work in a team, information literacy skills have been very handy. Similar to what Dr. Shikai said, we know the great work that the students have done in the department from the coursework. So we can teach some of those, applied skills and support those. So a lot of it is personality within our team, ability to take autonomy, ability to, in our case, when we recruited for a summer, they were not strict 9 to 5 hours, because we did evening recruitment in the emergency department. Some of our trainees have gone and visited some of our community partners like St. Vincent de Paul's, Street Health, amongst many others. Ability to work in a hybrid fashion, as needed. And willingness, maybe what I will add is a willingness a little bit to be flexible. So the truth of the matter is research is not this perfect systematic timetabled event where we can predict precisely the day that recruitment is going to start. And if COVID taught us nothing else in 2020, it was the ability to be able to pivot and have a few different tasks on the go to make sure it's a rich learning experience for the MPH students, while also driving for us our program of research forward.
Thank you. And let's go to the folks at Sunnybrook.
Sure, I can start and I'll turn it to Paige, but ultimately, IPAC really is a team sport, not only sort of within our team, but the broader healthcare team as well. We are a consult to the broader healthcare team. So every day looks different in infection control. So adaptability, agility, being technically savvy is also important. We have a lot of different systems that students access. Being on site is actually important. There is an element even sometimes where you have to talk to patients and go in patient rooms. So being on site is an important piece. Paige, I don't know if you have anything else to add.
I don't think I have a lot else to add. I think just that, the passion for infection control and the interest. So we look for that. We try to pick up on that in our interviews and the conversations, but definitely, as others have already mentioned, the team fit is probably one of the biggest things.
Yeah, I'm seeing a bit of a theme here with flexibility and the attitude that's brought, as well as the fit with the team. Megan, do you have anything else to add to that?
There we go. Ours is a little bit different. We look for people actually who are self-directed and independent. So for us, the staff are the ones that are doing more the team and collaborative work. So we have, I don't want to say all positions are independent, but a lot of them are. We do have some team type work, but it doesn't come up all that often. It depends on the placement, but generally we want people with strong stats skills and the ability to learn quickly a new program. We want people to be able to be keen to be able to do this. Excellent, I think people talked about this as excellent communication. So they ask clarifying questions when they're not sure, and they come to us when things aren't going quite right so that we can figure stuff out along the way and come up with a solution. We look for generally a strong base in systematic reviews and critical appraisal skills, because this comprises a lot of what the MPH placements are here. The NCCMT success pyramid, and knowledge of where to find good quality evidence repositories. Of course, strong writing skills, being able to write clearly, concisely, compelling, complete. Their grammar is good. It's professional what they're writing, sound development of arguments and supporting evidence. That we want them to have project management skills. So they need to develop a timeline of deliverables for the project and schedule them to meet those deliverables. We look for them to be keen and excited, because generally this translates into a better dynamic when they're here in person. We do require students to be here in person for the 5 days, having a growth mindset. So they're open to receiving feedback and incorporating it into different iterations of their knowledge product, their deliverable, having a CQI mindset, understanding that the different perspectives people providing feedback are coming from, and being open to that. Don't be afraid of the red. It's part of the process. And also most of the time there is no right answer. So being okay with ambiguity, being able to make decisions, evidence-based decisions just to move forward, and being okay with it. Understanding that projects are dynamic and the ask can change based on new information, and being okay with that. So these, the last two here are definitely difficult to assess in an interview, but yeah, we're looking for that. We're hoping that students are becoming okay with that growth mindset and being okay with ambiguity.
Yes, and so hearing a few similarities throughout there, and that'll be very helpful to our MPH students tuning in today, or any potential practicum preceptors. Students are just about to start their applications for their practicum placements for this summer, so this is very timely. Speaking of time, I think we're just about there. I just want to see if there's any additional questions from our audience members. I think we can squeeze one in. So I'll just give that a second. And Nikki, if there's any questions in Carruthers, happy to take those as well. I have a very quick question for anyone willing to answer. What are your thoughts on virtual versus in-person practicums, and maybe speaking really briefly to the pros and cons of each, maybe if you have experience as a preceptor in those contexts? This is open to anyone.
I would just quickly say that I know, and Heather already kind of mentioned that for us in infection control at Sunnybrook, I think it very much would have to be, or would be more beneficial to be in person, because there's so much you would miss. If it was virtual, it would really just be participating in meetings and potentially, you know, other types of educational sessions that we do. But you would miss out on so many of the hands-on day-to-day things, which is a huge piece of the learning of the practicum. So I think for us in our context, it would, you know, for sure we would benefit more from the in-person.
Great, thanks for that. Any other thoughts? Yeah, please.
Yeah, I can just add, because I certainly mentioned hybrid. For our purposes, it really has depended on the task at hand. So we do weekly team meetings, because we agree it's also a team sport. We do weekly team meetings by Zoom, and that has actually been really beneficial to our trainees, because often people may not be in Kingston, but we always also have in-person meetings to make sure we're having that team building skills as well. We invite our trainees to different presentations and opportunities that happen in our department, because when our trainees work with Dr. Bartels and I, they are part of the Department of Emergency Medicine, and we want to make sure they feel that way. For our upcoming training opportunity, which will largely be focused on patient recruitment this summer, it will be largely in person. So that's why for our setting and our context, it's mostly hybrid depending on the tasks at hand.
Okay, great. Thanks for those insights. Yeah, it's definitely not a one size fits all, and there's no right or wrong answer, I think. And it really depends on the type of work and of course the student and the host organization. So thanks for that. I think we're going to wrap up. I want to say thank you to all of our panelists for joining today and chatting with us for the past hour, but also your continued support of our students who benefit greatly, as we've talked about, from your mentorship. Also, thank you to everyone that joined in on Zoom today for your questions. Please, if something was not answered today, you can reach out to me or in fact, our preceptors who provided their contact info at the beginning there. So thank you, everyone. Have a great afternoon wherever you are. Okay.